Good afternoon, everyone. My name is Kim Stevenson, and I'm the Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Patient and Family Advisory Councils, Uplifting the Patient Voice for CMS Patient Safety Structural Measure Domain 5. A few logistics before we start. If you have any questions during the webinar, please enter them into the chat feature, as we are in listen-only mode today. The questions will come directly to us, and we will do our best to address as many as we can, both during and at the end of the presentation. I also want to take a moment now to thank MHA's 2025 annual sponsors and strategic business partners for their support in underwriting today's webinar, which is just one of many events that we offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm pleased to introduce our speaker from the Betsy Lehman Center for Patient Safety and from Cambridge Health Alliance today. First, we're going to welcome Jane Powers, Director of Patient and Family Advisory Councils at the Betsy Lehman Center for Patient Safety. Jane will kick us off by providing an overview of the center's comprehensive PFAC initiatives, which include shared learning opportunities, practical toolkits, and targeted hospital support designed to expand and strengthen advisory councils across the state. Also joining us are speakers from Cambridge Health Alliance, who will share real-world insights on how Cambridge Health Alliance has successfully amplified patient and family voices, demonstrating practical strategies for using advisory input to drive meaningful improvements in patient care and experiences. Aideen Snell is Director of Patient Experience at Cambridge Health Alliance and will share these real-world insights into how the organization has successfully elevated patient and family voices. And she'll also highlight practical strategies for using advisory input to create these meaningful improvements. I'd like to turn it over now to Jane. Thank you all for being here today and looking forward to the presentation.
Well, thanks so much, Kim. And I want to thank MHA for including me. And special thanks to Nick for helping with the slides. I'm really grateful that we're here to lift up the importance of amplifying the patient voice in healthcare. Next slide, please. I have no disclosures to make, so we'll go to the next slide. As most of you are probably aware, Massachusetts passed a law in 2008 requiring that all hospitals would have a patient and family advisory council. This legislation remains the only one of its kind in the country, but because the CMS Patient Safety Structural Measure is now asking hospitals across the country to attest that their hospital has a PFAC and that it's actively engaged in patient safety work, everybody is becoming more aware of PFACs, and they're becoming more of a focus across the country. I want to just lift up that there are 6 key features and benefits of PFACs. One is it's truly a patient-centered approach. It really prioritizes the patient's perspectives and that of their family members. It centers them in decision-making, and it really creates a culture of patient-centeredness. Number 2 is improved quality and safety, because PFACs provide feedback on processes, policies, and initiatives so they can help organizations identify and address areas where there's needed improvements. Number 3, enhanced patient experience. PFACs work to create a more positive experience where hopefully the care experience can be less stressful. Number 4, increased understanding and cooperation. Nope, I'm still on this slide. PFACs foster a collaborative environment between patients, families, and staff. It really builds trust and mutual respect. Number 5, dissemination of information. Obviously, PFACs can help to promote information about patient rights and responsibilities and programs. And lastly, advocacy. PFACs can empower patients and families to become informed advocates for their own care. Now we're going to go to the next slide, please. So who is Betsy Lehman? She was a young and nationally recognized Boston Globe health journalist, and she died in the early 1990s from a series of medical errors which led to a massive overdose in chemotherapy that she was receiving for breast cancer treatment. In creating the Betsy Lehman Center for Patient Safety, the Massachusetts legislature recognized the need for an independent, non-regulatory state agency that could serve as a coordinator and a convener, analyze data, and serve as a trusted resource of information about patient safety. The state's PFAC program came to the Betsy Lehman Center about 2 years ago. Next slide, please. The Betsy Lehman Center convened the Massachusetts Healthcare Safety and Quality Consortium, which was a group of over 35 healthcare organizations, patient advocates, and other stakeholders in our state. And together they developed the roadmap to healthcare safety in 2023. This is a strategic plan to break new ground on healthcare safety through investment and change management. Patient and family engagement is a key part of the roadmap. Next slide, please. The implementation plan contains over 30 different actions, and they're clustered in 5 identified goals. So patient and family participation is an important part of 2 out of those 5 goals in the operations and engagement sphere and in the patient and family support sphere. Next slide, please. And the Betsy Lehman Center has 3 programs that are related. One is peer support, and this is peer support both for clinicians and staff of hospitals when there's been an incident of patient harm, and also for family members who have had a loved one experience harm in their episode of care. We also have the Communication, Apology, and Resolution, or CARE program. And this program fosters a non-adversarial resolution process in compassionately meeting the needs of patients who have been harmed in healthcare. And then there's the PFAC program, which is the newest program that came to the center in 2023. If you're interested in learning more about any of these programs, you can check out our website. Next slide, please. So here are some of the ways that we support PFAC work in Massachusetts. Coaching and technical assistance, educational forums, online, and we hope to get back to doing them in person someday. We're going to be developing opportunities for virtual networking and mentoring between PFAC members who are interested in doing that. And we also collect annual reports from individual hospitals on their PFAC work. This year, we have a new annual report template tool, and it's now live. As a reminder for hospitals that are listening, the deadline is October 1st. We're having a series of office hours across the summer. You can register for the one coming up in August or the one coming up in September. And this year, our report has been halved in terms of length, and it includes a lot of drop-down menus and click boxes, which are going to enable us to collect data. And then we'll be able to share a snapshot of the PFAC work in Massachusetts. We're going to be able to also give each hospital a summary snapshot about how their PFAC work looks in light of what's happening across the rest of the state. Next slide, please. I've included a list of best practices. This is from the Institute for Patient and Family-Centered Care. These are all really important, and they probably look familiar if you've been doing any PFAC work, but we all need to be reminded of best practices from time to time. And you can review these when you get the slide deck after today's webinar. I think it's a great high-level summary, and I would just add one of my own best practice suggestion, which is I would really encourage everyone listening today to make sure to include patient safety as a focus, a key focus of your PFAC work. Not only is it the right thing to do for patients, but it's one of the things that you're going to be asked to attest to on the patient safety structural measure. Next slide, please. You can get a lot of resources on our Betsy Lehman Center PFAC webpage. The link is here, which you can access after the webinar. We have toolkit resources for building and sustaining PFACs, and including the patient voice in healthcare, and links to national organizations that are engaged in PFAC work. And also on this webpage, you can access previous forums, educational opportunities that we've had. You can see the videos there, including the most recent one in May, when we had a national expert, Barbara Lewis, who spoke about the importance of using metrics to demonstrate the value of PFAC work and your own PFAC's impact in the hospital. Next slide, please. My contact information is here. I'm always eager to hear from people that are doing this important work. So you can contact me. And I just want to share that as I was doing my initial outreach, I started in my position. It's a new position for Betsy Lehman, and I started in January. So I had the opportunity to speak with a lot of hospital PFAC leaders, and we're about to hear from one of them. I was really excited to hear about the work that's happening at Cambridge Health Alliance in my great introductory call with Adine Snell. So it's really my great pleasure to welcome Adine and her wonderful team from Cambridge Health Alliance, who are going to give us some real world examples about the importance of patient and family advisors and amplifying the patient voice in healthcare.
Jane, thank you so much for that introduction and great overview of patient engagement. We're looking forward to the resources to come from the Betsy Lehman Center in the year ahead with our PFAC. And thank you to everybody for joining this webinar today. My name is Adine Snell. I'm the Director of Patient Experience at Cambridge Health Alliance. And I'm joined by my colleagues, Maritza Velez and Corinne Alabre-Ryborg, who both work as patient relations consultants and human rights officers at CHA. We're honored to be here to discuss the CMS structural measures, Domain 5, and which centers on integrating the patient voice into our safety initiatives. Next slide. So patients perceive care as safer and more respectful when staff communicate and collaborate effectively with them and their families. We have a lot to share with you today about our journey and how we've changed the patient experience at CHA. But first, I'll do a quick overview of Cambridge Health Alliance, who we are, our commitment to zero harm, and we'll talk about cultivating a culture of safety with our high reliability journey. And that has been the focus and framework of our patient experience transformation. Then finally, we have important guests with us today, and there are patient partners who actually sit on committees at CHA and have for some time. And so they're going to share their experience with you, and hopefully we'll have some time for discussion or questions at the end. Next slide. CHA is a really special place, both to work and to receive care. Our workforce is truly committed to the mission and values of the organization, which gives us a really unique opportunity. We have 3 acute care community hospitals and 13 community care centers. We have a large growing mental health footprint in the area, and we serve the cities and towns north of Boston. It's a safety net hospital with a long history and expertise of serving the underserved. And 50% of our patient population are non-English speaking, and more than 50% are Medicaid insured. Next slide. CHA is a mission-driven organization focused on improving the health of its communities and specializing in care for patients with complex needs and those who face significant barriers to health. And it's we aim to provide care without discrimination or judgment. Next slide. So through this presentation, you'll see our leadership's commitment to eliminating preventable harm. This visual here is of our strategic goals, was part of a 5-year strategic plan, with the top pillar being patient first. It was identified quickly, though, that we had significant barriers to achieving the patient first work and really engaging our patient advisors. So we needed to address things like access, operational infrastructure, and a post-pandemic need to prioritize our workforce. We all remember 5 years ago, times were very different than they are now. And many of those barriers have now been addressed. And on July 1st, we kicked off our 5th year of this strategic plan with a renewed attention to patient first. Next slide. You've all seen this, and Jane just spoke to it as well. It's our domain 5 of the structural measures. And CHA is in full compliance. We have had the opportunity to have a PFAC for many years with the Massachusetts state regulatory guidelines. But this, domain emphasizes the integration of patient voices into safety initiatives. And I'm going to share with you how we've put patient experience into our quality and safety department, and we'll talk about that that journey. But we today we're going to talk about different ways, additional ways that we have integrated partnering with patients and families and embedding those voices to help drive progress towards our goals. Next slide. So it's important, I mentioned earlier about our high reliability work. So it's important to mention our framework, which helps shape our patient experience transformation. This journey was a journey to zero harm, began in 2023 with our partners with Press Ganey. And we created 2 behavioral portfolios to address. Can't go into all the details of our high reliability journey, but I think these are the most significant to bring forth in terms of creating a shared language with something we called our everybody behaviors. And it encouraged staff to speak up for safety and communicate clearly. We also created leadership behaviors, which fostered psychological safety, an environment for staff to speak up and ask questions, but also creating mechanisms for leaders to learn about what's happening on the ground through huddles and learning boards and regular rounding, really boosting the communication across the board. Creating consistency across the organization was important, and facilitating problem solving in real time and responding to mistakes fairly with a just culture. Next slide. So our progress has been evident while on this journey. It never ends. We have observed a reduction in our preventable harm to patients and to staff. We're seeing an improvement in patient experience scores as well as employee engagement. So this brings me to more of the why we're all here to talk today, and that's about our patient experience transformation. And I'd like to share with you some key deliverables in our strategic plan. Next slide. So with our focus on patient engagement and experience, the tactics to further embed the patient voice into our daily work, we're ensuring that patient voices are reaching the front line, both to clinical and non-clinical staff. It's important for everybody to understand their role in the patient experience. We're providing tools and resources to support staff with a data-driven approach to planning and to action planning, and to continue to support staff on how to manage challenging situations, build trust with those we serve, and to address any disparities that are happening in our experience data. By reinforcing our everybody behaviors, I'd like to share Shayna's story. Next slide. So just as a way to reinforce these goals, Shayna came to our organization for surgery. She has autism and has been seen at many hospitals in the area. The parents were really taken back by the care she received and how staff were so dedicated to really understanding her unique needs. And they attributed her recovery, her rapid recovery to her surgery based on that, even to the discharge planning and thinking about what would be best for Shayna at home. So we asked if we could share her story to support our staff and recognize them in the various departments she touched along the way. And they sent these pictures, and I asked for a picture of Shayna. She wanted to include one that she was very proud of winning a medal at the recent Special Olympics. So just a way to share a story and reinforce with our staff those compassionate connection, clear communication, all those everybody behaviors that are so clearly important in the patient experience. Next slide. So how did we get here? Or how did we get there? I'd like to introduce our small but mighty team. Without their patience throughout this journey, it would not have been possible. One of our teammates cannot join us today, Sanjaleen, but we have an exceptional team that's deeply committed to the CHA mission, and their diverse backgrounds and bilingual capabilities contribute to the patient-centered, empathetic, and compassionate care that enhances our services. Their expertise and support of our service line leaders and frontline staff is invaluable with daily coaching and walking through patient needs. Next slide. This is just a timeline of what was implemented when. So we established patient experience in quality and patient safety in 2022. This integration included the addition of human rights officers to patient relations with our growing behavioral health service line. And the team also assumed responsibility for an existing PFAC at that time. Key initiatives, including aligning high reliability work and the launch of our high reliability curriculum with patient experience, and a keen focus on emotional harm awareness, tracking and improving relationship management within patient relations, and how we categorize our complaints. Next slide. This slide provides a high-level overview of the patient relations team's responsibilities. And through this transition, patient relationship management has evolved from a reactive state to a proactive, trust-building partnership with service line leaders, patients, and families. Next slide. So here's our data. It's trending in the right direction. This is a composite score across our entire, all of our service lines, so including inpatient, our ED, behavioral health, and ambulatory settings. And our patients are clearly seeing a difference. This is on the left side, you see our likelihood to recommend, our Net Promoter Score. And on the right, it's our staff work together to care for you, which is known as a key indicator of patients feeling safe. We are seeing open comments from patients that specifically call out our everybody behaviors, which has really helped with staff recognition. We're hearing things like compassionate care and clear communication. And we're also seeing staff who are coming through our ED or different service lines as patients, and they're feeling pride in where they work. Which is really insightful to the culture change that's happening. Next slide. Just another two patient voices that I wanted to share, one of which is turning a challenging situation into a positive partnership. So through our PFAC recruitment, one of the challenges is to get a membership representation that matches our patient population. And so it's been a key point that a lot of our patients that come through patient relations when things have not gone well end up being excellent advocates and end up working as a patient advisor going forward. So that was the case with Heidi here. And again, we used Heidi's story to celebrate during Patient Experience Week and recognize staff. She's now a member of our PFAC. And then this Patty and Marco shared their story where Marco came in with a head injury into the ED, and Mom really shared how, transparently shared how she's distrustful going into an ED and how she's going to be treated and given their diversity and has had negative experiences in the past. But she couldn't say enough about the provider, about how much time they spent to really give her details about why they were making the assessment they were making, what would be, the signs and symptoms they're looking for. And she felt that because of that amount of detail provided, she could see her son's stress reduced because her stress reduced. She knew the child was feeding off of her anxiety, and she was just truly grateful, reaching out and asking to be able to recognize the staff. Which brings me to emotional harm in our next slide. So our journey to zero harm is to mitigate avoidable suffering. And through this transformation, we've streamlined a lot of our internal management of patient inquiries. We've increased education, and we've enhanced our data tracking. And the most impactful change that we've made is tracking emotional harm. Emotional harm is, the research is clear. Patients that experience emotional harm are more likely to experience physical harm in the future. So this has been a key area for us to educate, but identifying emotional harm can be really challenging, particularly in a complex, diverse setting like CHA. So it's subjective in nature. It's characterized as failure to demonstrate compassion, empathy, and respect. And it impacts more vulnerable patients. It often goes underreported. So we know that even though we're tracking it, there's likely more episodes of emotional harm out there that we're unaware of. So in the first year of tracking emotional harm, which was in 2024, we learned that 32% of our complaints and grievance had an emotional harm component. 7% were related to REL-SOGI, which is race, ethnicity, language, sexual orientation, or gender identity, and 3% related to a disability. So that's great data, right? But what do you do with that? And so since then, we've been working with Press Ganey to get further categorization and be able to quantify the level of emotional harm, to learn and understand more so that we can address these things and highlight those for opportunities of improvement. So next slide. So our journey started with making sure that all our staff understood the complaints process and their role in the complaints process. So there's a lot of resources on this page, but I just wanted to show you some of the tactical strategies that we used to focus on frontline de-escalation and supervisor resolution. Patient relations can be a resource and a help with staff in coaching, in managing complaints. But we really need to take that first step to manage them at the point of care and empower our staff to have the tools to be able to provide resolution and talk to patients about what their frustrations are and feel heard at that point of care. So we did a lot of education with staff. We defined our process clearly, so there were resources available. We also found that we needed to improve wayfinding. And you hear wayfinding for patients to get through the facility, but really wayfinding for staff. Staff weren't sure where they should send the patients when a need came up at the front desk or somewhere through their journey. And often their default was to go to patient relations. But that's just adding extra steps if it's something that they needed on a medical record or they needed finance support. So we created this service recovery card. And it's just an easy tool for staff to have right there. They can check the box of where the patients need to go. And the effort is to try and get them to to where they need to be most directly. And this was offered in multiple languages, and not each card having a different language, but on the back offering multiple languages to tell them where to find the information with a QR code that goes to our website, because the CHA website is offered in multiple languages. You just toggle over the top right corner and you can select your language of care. So this was a great resource. We created it for primary care initially, and it ended up being welcomed from all our service lines. And it's also been added to our welcome packet in our inpatient stay because it's been very effective. Another effective tool we created was our EPAT huddle. And this is an escalated patient assessment team. And it basically integrates communication for complex escalations. So we had some situations that were rapidly escalating. The patient would either go to outside agencies to complain, or they'd go to our leadership, our C-suite, or they'd go to multiple departments, and they'd get different information sometimes from different departments. And so now we identify these early on. We sense the level of frustration that's happening, and through that assessment, we pull together all key stakeholders. So whatever departments the patient had touched, and the primary objective is to formulate an immediate strategy with key stakeholders, establish a unified plan, and with a single point of contact. That was crucial for the process, that the patient knew there were boundaries and that there was one point of contact to keep the information consistent. Next slide. This is a snapshot of our patient and family advisor program. They are our partners. They help us drive progress towards goals. But here I'd like to highlight our committees. So on the right side, you'll see all the committees that we have patient partners represented on. Patients Safety Council, Health Equity, Technology Advancement, to name a few. And you'll have an opportunity to hear from some of the advisors on these councils. But this is an area that we're constantly growing. It's fluid. We get some years and lose some other years. But recruitment is ongoing. We get referrals from providers. We do advertising through our newsletters. And we also, as I mentioned earlier, we tap into when there's a bad situation that a patient shows excellent advocacy skills, and they're able to kind of look at the bigger picture. They're often recruited to be an advisor going forward. Next slide. Another tool has been our high reliability journey. We've developed a really robust curriculum surrounding high reliability. A lot of work has gone into monthly reminders, and those include videos and tip sheets for every behavior. Earlier, I showed you we had our leader behaviors and we had our everybody behaviors. And under each of those 5 behaviors are skills. And so we provide skills and tip sheets to help them, to help staff reinforce that. So that could be anything from an S-bar for clear communication, or 3-way repeat back with patients. And the one that I'm sharing here is our 3 A's for service recovery. And I'd like to share with you a video that we have. The videos are very brief. We've used them to educate staff. This is just one of them. There's one for each of the behaviors. And we'll just show a clip, but we will provide you the link. So if you want to see the full video later, and I will just play it now.
Hi, everyone. We're all here today to talk about a really important everybody skill. The 3 A's for service recovery: acknowledge, apologize, and amends. First, let's take a minute to find out why this is so important.
We work in healthcare, so whether we're at a hospital, a clinic, a professional office, or working remotely, we always try to help people.
Despite all our hard work, sometimes things happen that are beyond our control. This is frustrating for patients, families, and coworkers.
But at CHA, we're all responsible for things our patients experience. That's 200% accountability. And we can all control how we respond to complaints and concerns using the 3 A's.
I'm here with Gloria, one of our patient partners, to explain more about the 3 A's of service recovery.
I guess I'm here to give the patient perspective, but let's remember that we're all patients sometimes. So we all know what it's like to be frustrated or feel disrespected. It can make you angry and cause emotional harm. So when delays, mistakes, and opportunities for improvement happen, we start by acknowledging them. By owning these issues, we let our patients know we care.
Mrs. Johnson, I know the elevator's broken and you had to take the long way to get here with your wheelchair. You must be really frustrated. I want to speak for all the staff and say we're sorry this happened. The repairman's fixing the elevator, but it may take a while. Would you mind if I helped you on the way out?
Okay, did you catch all that? He acknowledged the facility issues and delays and used empathy ESP, another of our everybody skills. He then apologized and tried to make amends using the 3 A's to guide the conversation. Here's another example of using the 3 A's with a patient who's frustrated. I'm Gloria Johnson, and I'm here to pick up my medications.
That's strange. Oh gosh, we don't have them. Let me get the pharmacist to find out what happened.
You know, I've been waiting in line, and it's not exactly easy for me to get around.
Mrs. Johnson, I know you've been waiting and we had a mix-up with your prescription. I'm so sorry this all happened to you. It's just so busy here sometimes. But I was able to fill your medication. How else can I help? Do you have any questions?
This was a great example of the 3 A's, including a blameless apology. This lets you be sincere without blaming yourself or others. Now let's see another great patient example.
Hi, this is the CHA call center. How can I help you?
Hi, this is Gloria Johnson. I'm a patient at Malden Family Medicine. I need to get in to see Dr. Sullivan. It's a bit urgent.
Sure, Miss Johnson. Is that JOHNSON? Can you give me your date of birth so I can pull up your record?
Yes, and that's Mrs. Johnson, and it's March 30th, 1948.
Okay, I'm gonna read that back to you. March 30th, 1948. Looks like there's an open appointment with Dr. Sullivan next month, Tuesday the 23rd at 10 a.m.
But that's 5 weeks away. I can't wait that long.
I know that's a long time. I understand your concern. I'm very sorry about the delay. Dr. Sullivan is just so busy these days.
You know this is unacceptable.
Thanks, Nick. So that's just a great example of one of the videos that has gone out. A lot of intention has gone into these videos. You'll see some reinforcement with naming some of the other behaviors, not just the 3 A's for service recovery, but they talked about empathy. And these have been really instrumental with the sustainability of our HRO work. Our providers, our patient advisors, we brought this to PFAC. They've also gave us suggestions on our curriculum. They were involved in a lot of this work, but it's also transferable for staff to staff. A little later in that video, if you want to view the link, it talks about 3 A's for service recovery with coworkers. So internally, things happen, people make mistakes or may have, misunderstood a situation, and encouraging staff to use 3 A's for service recovery, empathy, clear communication, all those skills in their communication with each other. So it's really made a big impact on our culture. Next slide. So another heavy slide, but just want to show you some additional resources and tools in making data visible and accessible, and how this patient experience journey has been visible through our organization. We've provided clear steps for staff and guidelines for how to share patient voices. So when we get our survey data coming in, they get weekly comments, but then using them and using the HRO skills and tools to share them with staff so it gets to the front line. So there's an example there where we show using huddles and our learning boards to share patient voices and linking the data to those patient voices. So the picture on the bottom left is a picture of one of our learning boards. And in zone 3, we show outcome measures that we're tracking for goals. This would be for a specific service line. And this is where the staff huddle around the board to communicate in the morning. They have a quick huddle to elevate any safety concerns. They do a quick look ahead and a look back. And these are great tools for sharing patient voices, but linking them to what our outcomes, what our shared goal is for patient experience in that area. The monthly excerpts are shared with our board member, and they look forward to hearing them every month. And this again reinforces just our leadership's commitment to this work, which is imperative to its success. So now we're going to hear from some of our experts, our advisors. We have Farah, Alexandra, and Andrea joining us. They have been members of our PFAC and committees for a long time. And they're going to take a few minutes to just share a little bit with you what it was like to join, what keeps them coming back, and hopefully we'll have some time after they speak to ask some questions. So I'm going to hand it over. I think Alexandra is going to start us off.
Thank you for that. Thank you for that introduction, Nadine. I have participated in Cambridge Health Alliance Patient and Family Advisory Council for a number of years. The changing severity of my health issues has pulled me away from it at times. I always miss this work, and when my health improves, I look forward to returning. It is a very fulfilling experience, fueled by the satisfaction and pride I feel when my voice, a patient's voice, is heard. Not only heard, but sought after. The depth and breadth of how many different departments seek out time on our monthly agenda is a big reason I have stuck with this work as long as I have. Those same departments who involve our PFAC in their projects do a great job of returning to share the tangible changes and results from our patient feedback. Other healthcare systems I have experienced made me feel like a number and not a person. CHA has never made me feel this way. I feel valued here, and I know my time, experiences, and input make a difference on every project I have been a part of. From consulting on patient-facing materials to being a part of the rapidly evolving telehealth implementation that happened during the pandemic, as well as the improvement projects regarding wayfinding around the hospitals. My voice matters here. Thank you for listening to my experiences with CHA's PFAC. I would like to introduce my fellow council member, Farah, to talk about her perspective.
Thank you so much, Alexandra. Good afternoon, everyone. My name is Farah, and I have proudly been with CHA since 2013 as a patient advisor. I still remember that phone call that I got saying, "You've been referred by your provider, and we'd love to have you on our patient partner team." I was honored and honestly a little scared. I kept thinking to myself, how will I do this? I don't have a medical background. How am I going to sit in a room full of doctors or medical teams? How will we make this work? So I was like, okay, well, they invited me, so I should go and go to the meeting and sit with them, and we'll just see if they could really, do something with them. So I went for it. I took that leap, and I went in, had my first meeting, and as we were sitting on the table with all the doctors, I listened to everyone explain their roles, and to my surprise, they made me feel completely comfortable. They would pause to explain the medical terminology, the acronyms, and I didn't even have to ask. They would they made me feel so welcome and just a part of the team. So that took a little pressure off. From that day forward, I truly felt like a valued member of the team. It's hard to summarize everything I've done as a patient advisor since 2013. But if I would like to share some experience that I think that was very meaningful to me, is one of my projects that I was working on called My Chart. I'm sure many of you know about the portal. But I'll be honest, I feel like I own my chart. And I know you're thinking, yeah, right. But I kid you not. If you knew how much work and effort and time that goes into every feature, every notification, every line of text, and how the app functions, you'd understand my pride. I tested it. I tested it not just as a patient, but as a mother of two, a daughter-in-law helping take care of both of her mother-in-law and father-in-law, who are limited English proficient. I wanted to make sure that it works for real families in real situations. Working with the IT team, working with, using those on a daily basis made me share that experience. And that's what made me feel valued. That's what made me, give them my opinions and my suggestions. So there was room for improvement and they would see where it's coming from. And I've been here since 2013, and this is what's, keeps me going. And I've become so passionate about it. But I could sit here all day and explain everything that I've done with them. And they've been so inviting with CHA that I just feel like one of them. And we've been always respected as a team member. But that's enough said for me. I'd like to introduce you to my colleague or council member, Andrea. Thank you.
Thank you so much, Farah. That was great. Much appreciated. First of all, I want to thank Massachusetts Hospital Association for having us today. Are you? Got it? Okay. I'm a small business owner of a consultancy, a dedicated community member, and a resident of Cambridge, Massachusetts. A lifelong member of Cambridge Health Alliance, where I've been a patient advisor since the spring of 2018. What initially drew me to this work several years ago was an uncomfortable experience that I had with a new doctor. But what has kept me in this work is the respect, sincere admiration, equity, and knowing that my commitment to this organization has in part helped foster CHA's high reliability. That my involvement makes a difference, and that genuine appreciation for patient input strengthens deeper engagement and encourages us as advisors to lead plus serve in other capacities. It takes a real dose of initiative, confidence, and real commitment. In doing so, I was sought to serve on our Health Equity Committee, speak at roundtables, engage in specialty projects, some of which my fellow colleagues have mentioned earlier, and be invited to represent CHA as an advisor in various settings. One of the major highlights for me was being chosen as the only non-medical personnel in the entire organization to be a part of the CEO hiring process back in 2019. I was on a team interviewing the final candidates for that position. Now, when I was contacted by our CHA Foundation President and Chief Community Officer, along with the Chief of Staff to the former CEO, to take on this highly regarded position, I can't tell you, I was beyond honored. And believe me, if I didn't know then how much I was treasured as a patient advisor, I certainly knew after I received that call. Now, allow me to share a personal anecdote. At the most challenging time of my life, fighting stage 3 breast cancer during the global COVID-19 pandemic,
I remained engaged as a patient advisor. Why, you ask? Because it was an opportunity for me to stay connected. I knew that my input, guidance was necessary and needed, and most importantly, valued. All in all, it's an honor, a huge, wonderful honor to be a member and serve as a CHA patient partner. Thank you. Now, allow me to turn it back over to my colleague, Aideen, to facilitate Q&A and to close us out.
Thank you so much, Andrea, Alexandra, and Farah. We're so grateful for your support and being advisors. And we're so grateful for everybody who attended this webinar today. We want to give you the opportunity to ask questions, but if there's anything down the road, I'm providing my email address, Corrine and Maritz's as well. We'd be happy to answer any questions for you. But I also, we can take down the slides and have an open discussion now.
Thank you, Aideen, and thank you, everyone. Wonderful, wonderful presentations. So we do have a number of questions that have come in. First question from Shelby, what is your patient satisfaction survey response rate?
So we are challenged, as many. We compare to the national average. Each area is different. Some areas better than others. So we are a little bit below the national average. We've actually kicked off some efforts to really share with staff how share with patients how their voices are valued. So we've started sharing at the end of the year all the different projects that have actually gotten patient input and made a change, and trying to encourage patients to fill the survey out so that we can increase those rates. But to answer your question, we're just slightly below the national average.
Thank you. And another question, do you have any service line PFACs, such as perinatal PFAC?
We have in the past, and following COVID, that was difficult to maintain with different challenges. So we decided to streamline it in the last 3 years when it came to quality and safety, and have this more safety improvement approach. So at this time, no, we just have our organizational PFAC. We do have one for our ACO as well, which is also required in Massachusetts.
And how have you been able to assess the financial value of patient experience in PFACs? This commenter or question submitter says, we are struggling to prove our impact on revenue outside of growth or retention goals.
Yeah, that is a big challenge. And actually, it stuck out to me when Jane mentioned that there's a video recording of a presentation she had to address just that. It is challenging to provide that return on investment. So it's something that we're working on. But when the high reliability was implemented, it really shows the change to our outcome measures. And so that really helps. And I think that data-driven approach, we're also tracking additional information. I mentioned emotional harm and the RELD SOGI related complaints and grievances. And so being able to show reductions there, related to our health equity work and is really helpful. So I think the more data we can take from patients, quantified data is important.
There's a couple of questions here that relate to training or education for your PFAC members. Do you want to speak about what is available in terms of educating or training the PFAC members and what you're looking for and how to be great members of the councils?
Yeah, so we have used some online resources that are out there to, really identify ways to be included. We've created documents that talk about, thinking outside of your experience and how to be able to give input and be more knowledgeable on what's going on at a broader level than just your own experience. But it's something that we actually spoke with Jane in our conversation initially. It's something that the Betsy Lehman Center is really invested in, because I think it's challenging for all of us. PFAC usually doesn't get a lot of resources. And so we're pulling together things that, to have a larger overarching educational opportunity would be a great resource, because it's an area that we're challenged in. I would love to do a lot more training. We definitely bring things to PFAC that help to educate, but there's always opportunity for more. We have a large e-advisor program, and that's really where I would like to focus some of the education, because those are they're all virtual, so they're not coming to a committee meeting. They're more so working on a specific project. So lots of opportunity to improve that.
Wonderful. And we have a few questions around the impact on various efforts. So one question is, sorry, I just lost it. What impact to safety have you seen from these efforts, and what improved outcomes have you seen related to the PFACs?
Yeah, so we're seeing improved, less harm to patients, less harm to staff. And, in our high reliability journey, we learned that it was safer to build a hospital than to work in a hospital. And so that was a key focus. Another key measure is our employee engagement. Coming out of the pandemic, we know that there's a lot of burnout in healthcare, and our employee engagement scores were showing us that. And so we've seen an increase. We're about to launch another survey coming up. And then I shared the data of our patient experience. We're seeing an increase in our likelihood to recommend, but our staff work together to care for you, I think, is really the significant measure that's increasing and directly related to safety.
Thank you. And how successful has your comment card strategy been in reducing complaints that the team were unaware of prior to the patient's discharge?
Clarifying question there, is it the service recovery card?
Yeah, I think that's what it sounds like.
Okay. And what was the second part of the question?
So how successful has it been in reducing complaints that the team were unaware of prior to the patient's discharge?
So we've had a 40% reduction in complaints from 2024. And I can't specifically say that they were complaints that staff weren't aware of before discharge. That number is crossing all service lines, so it's not just inpatient. But we are seeing a huge impact. We still get lots of volume into patient relations. We're in a complex population, a lot of elder care, and so that leads to a higher volume of patient relations complaints typically, or inquiries, I should say. But we are seeing that staff are more so calling to say, hey, I have this situation. This is what I did. Do you recommend anything else? And before it was, here's the patient relations number. And so that satisfaction of, staff knowing how to handle it, and then knowing that it's okay to escalate it to a manager to step in and resolve in the moment, and knowing that they have us to reach out to, has been very effective.
Great. And how many members are on your PFAC, and do you have tips for recruiting members? What are your strategies for recruiting?
So we have, I think our last number was about 16 members. It was in the single digits 3 years ago when we took it over in terms of active members. We probably have slightly over that number in people who have just come for like a trial meeting. And the recruitment has been most successful has been referrals. So if a provider, I think Farah mentioned that her provider actually thought that she would make a great advocate and said to her, you should consider PFAC. A lot of times we get calls in patient relations that don't end up going to a significant complaint, but they say, I just want you to be aware of this, or, this was really frustrating. And those are great opportunities to say, like, wow, you make a great advocate, and thank you so much for bringing this to our attention. And so that's really been successful. We also provide cards. I know we're at time quickly, cards to provide the provider so that they have the language to be able to talk about it. And then we have a page on our website to give more information.
Wonderful. Thank you. And yes, I recognize that we are now over time by a minute. So I think we'll wrap up. Unfortunately, there were some additional questions we were not able to get to, but we do have Aideen and Jane's contact information in the slides. Everybody will be receiving a copy of the slides as well as the recording. So if you weren't able to get your question answered right now during the webinar, I would definitely encourage you to reach out to Aideen or to Jane or to any of the other members of the call today to discuss further. Thank you, Aideen, and everyone. We really appreciate all of your work on this. It's such important work, and thank you for sharing it all. And thank you to the patient advisors who took time out of their day to come and share with us as well.
Yes.
Thanks. We have a few upcoming events, but you can see all of them on our website by clicking on the QR code or going to our website. And we look forward to seeing you all again at a future event. Thank you, everybody. Have a good afternoon.
Bye-bye.